For generations, men have been taught that standing to pee is, well, natural, efficient, even a badge of masculinity. Bathrooms are built for it. Culture reinforces it. Few of us ever question it. But here's the surprising truth. Standing to urinate may not always be the healthiest choice. In fact, for many men, sitting down can be far better for bladder and prostate health. This isn't about etiquette or convenience. It's about anatomy, muscle function, and long-term urinary health. Let's break it down. Hey, I'm Vic Senese. I'm your host of UroNurse News, and don't forget to like and subscribe. So let's talk about urination. It's a coordinated process. It involves the bladder, which stores urine, the detrusor muscle, that's the name of the bladder, which contracts to push urine out, and the urethral sphincter, which is what keeps you from wetting yourself, that has to relax and allow flow. Now, the pelvic floor muscles, which must fully relax and for complete emptying, they have to fully relax. So here's the problem. Standing makes it harder for men to fully relax their pelvic floor. When standing, the body is in a semi-alert posture. You engage some of your core muscles, your glutes, your thighs, and pelvic floor to stay partially engaged to maintain our balance. That subtle tension can interfere with complete bladder emptying. Common problems linked to standing include incomplete bladder emptying, leaving urine behind, which can increase infection risk. Weak or interrupted urine stream, thanks to that extra tension from the pelvis. Dribbling after urination or leftover urine that leaks out. Increased strain, pushing or bearing down, which can worsen pelvic floor issues. For younger men with no urinary problems, this may not matter much. But as we age, men over 40, or those with prostate enlargements, urinary hesitance, or nighttime urination, standing can become inefficient and even risky. As men age, the prostate gland often enlarges, narrowing the urethra. Standing while peeing forces urine through a tighter passage, while the pelvic floor remains slightly tensed up to keep you standing. Sitting, on the other hand, tilts the pelvis and allows the muscles to relax, making it easier to empty the bladder fully. Urologists often recommend sitting for men with BPH, or benign prostatic hyperplasia, weak urine stream, frequent nighttime trips, and post-void dribbling. Now, I got to be the first one to admit I've been urinating all wrong according to this study. Sitting changes urination mechanics in several important ways. This makes a lot of sense now. Better pelvic floor relaxation. The pelvis tilts back, letting muscles loosen. More complete bladder emptying with that less residual urine. And improved urine flow. Stronger, steadier stream. Reduced dribbling. Less leftover urine. Lowers the risk of urinary tract problems. Stagnant urine is a breeding ground for bacteria. And it's not just health. Hygiene improves too. Standing can create microscopic urine droplets that land on toilet seats, floors, clothing, and skin. Sitting nearly eliminates splashback. And for your partners, that may be a big deal. So sitting can reduce risk of falling at nighttime too during those bathroom trips, sometimes often overlooked. So now let's address the elephant in the room. Masculinity myths. Standing has been framed as manly, while sitting is sometimes mocked. But from a medical standpoint, there's nothing masculine or inefficient about bladder emptying. So some countries already consider sitting normal. The resistance is cultural, not scientific. And as we point out there, can be less messy. You're not missing the toilet. Here's another interesting fact. Erections, ejaculation control, and orgasm intensity are linked to pelvic floor health. Sitting actually helps train these muscles discreetly. Well, if you're looking for a good reason to sit to pee, there it is. Basic seated pelvic floor exercises. Find the muscles, gently stop urine mid-flow once to identify it. Then you can do what's called a seated Kegel. And don't do this constantly with the stopping the urine. That's just to figure out what muscle. Contract for 3 to 5 seconds, relax for 5. Do 10 reps, 2 to 3 sets a day. Endurance holds, 50 to 60% contraction for 10 to 20 seconds, 5 to 8 reps. Quick pulses, contract, relax, 20 to 30 pulses, sets of 1 to 2. These are all great exercises that you can do to improve your pelvic floor. And the bonus is it may improve your erection strength, blood flow, and ejaculatory control. So who benefits from sitting to pee most? Well, men over 40, men with enlarged prostates, those with frequent nighttime urination, men with weak streams, dribbling, or pelvic floor tension. Sitting is not just a preference, it's preventative health strategy. All right, I'll probably give it a try. Sometimes better health doesn't come from medications or treatments. It comes from doing a familiar thing in a smarter way. In this case, men just might need to take a seat. Thank you for joining me. I'm Vic Senese, and this has been UroNurse News. Remember, small changes can make a big difference in urinary and prostate health. Hey, join me tomorrow on UroNurse as special guest Eric Johannesson, MD, dives into the latest strategies for optimizing care in advanced renal cell carcinoma. Now, this is for all urology healthcare learners. Learn how immunotherapy and targeted agents are changing the game for patient care, how you can maximize their potentials. Plus, this session offers 1 contact hour of professional credits. So tune in tomorrow on UroNurse to learn more.
UroNurse Speed Run. Let's learn and share on YouTube, LinkedIn, X, and Facebook, everywhere.